Good afternoon, everyone. It's great to connect. I just returned from a great visit to Northern Kentucky, visiting several of the superintendents up there and getting the tour Fort Thomas School District and see some of the great programs that Karen Chester and her team have built up in that district. So I'm coming to you from my home in Lexington this afternoon. I always am reminded this time of year when people ask me, or they ask the question, are we winding down the school year? And I want to tell them that's not how this works. This is the sprint at the end of what feels like a double marathon, and that's been especially true this year with everything that we've gone through with COVID. We have a packed agenda for you this afternoon. We've got Dr. White and Dr. Stack on to talk about school vaccination site information. We're happy and excited about that opportunity. We'll talk to you some about the American Rescue Plan and some funding that you'll be receiving through that, and some how that will work in your districts. School and community nutrition update, trauma-informed plans, and the School Safety and Resilience Act, and everyone's favorite topic, the supplemental school year program, and how you'll be working to manage that through the GMAP system. And then, as always, we'll have reserve the balance of our time for just questions, answers, and discussions, and we look forward to that portion as well. So, Tony, let me turn things over to you. Tony Constatman, our Chief Communications Officer, for that communications update.
All right, thank you, Commissioner. A couple of things, as Dr. Glass said, it's been a very busy month, so a couple of things I just want to put on your radars. First and foremost, tonight we are kicking off our final stop in the Commissioner's Listening Tour. We've had more than 1,000 people that have joined us and shared their thoughts so far, and you can register for that. You still have time for the Zoom link. You can go to our website under the Commissioner's Listening Tour tab and register, and you will get a link instantly to be able to join us for that. Our next steps with the listening tour is that we are going to be forming the Kentucky Coalition for Advancing Education. It will be announced tomorrow, so you're getting a little bit of an advance notice on that. It'll be a joint project of the Department of Education, the Center for Innovation in Education, and the Kentucky Board of Education. And this coalition you've been hearing a lot about if you've been joining us for the virtual tours, and they will begin meeting weekly in June. And there'll be an online application that will be sent out. We're looking for some members from your districts and from the public and from our communities to join, and we'll be sending that out tomorrow via press release. So just a sneak peek there for you on that. Letting you know that our Student Advisory Council, many of you have asked me about the status of that. We are going through the selection process on that and hope to have our new student members named by the end of the month. A couple of deadlines for you. The Kentucky Board of Education is accepting nominations for the Grissom Award in Innovation in Special Education. The deadline for that is this Friday. This is a great opportunity to nominate someone in your community, in your districts, who have dedicated and shown some innovation in special education. And the links on this is you can nominate is on our website, but also in your PowerPoint. And then one other thing I wanted to mention for today with a really quick deadline is the GMAT, or not the GMAT, we're going to get that in a minute, but the questionnaire regarding 2021-22 school year kindergarten funding. We need to get that survey filled out by the end of the day today. You received an email about that last week. And again, the form is either in your email or you can find it in your PowerPoint. My last slide before diverting over to our friends at DPH is just an update that our Healthy at School guidance was updated on May 3rd to include the new guidance on not wearing face masks while outside. And those changes can be found on pages 6 and 11. And with that, I would like to toss it over to Dr. White and Dr. Stack, who are going to be providing some updates on our school vaccination site information and other updates from DPH. Dr. White, Dr. Stack, thank you for joining us.
Thank you, Tony. And thank you, Dr. White, for being with this community so often to help extend KDPH and be a resource to them. I'm grateful for that. What I wanted to share here on this slide, keep the slide up. People capture information off of this if you want, and let me kind of give some context. So We have now crossed over 1.9 million Kentuckians vaccinated in the state of Kentucky as of today, I believe. We would really like to get to that 2.5 million person milestone, which would represent 70% of the adult population as defined by being 18 and over. I think we all very clearly know that the people who are most eager to be vaccinated have by far and away been vaccinated. They've been able to get access to it up till this point. The scarcity of vaccine that we had for multiple months in the beginning is no longer a problem. There is plenty of vaccine now. There's vaccine all over. You can go to virtually any pharmacy in any community and get vaccinated. You can go to a number of hospitals, not all. You can go to most health departments. Matter of fact, probably almost all health departments and get vaccinated. And now we will begin to see vaccines showing up in some doctors' offices some of it has already started, but it'll probably take some time and escalate in the weeks ahead. So vaccine has now become much more available. I think you've all heard the news and are aware that yesterday the Food and Drug Administration did vote to approve or did approve the change in the authorization for Pfizer. And now Pfizer may be used in persons aged 12, 13, 14, and 15, in addition to the 16 and above that it has been approved for all along. The Pfizer, just by way of your background information, they did additional research in up to 2,300 or so children 12 to 15, found that the vaccine was tolerated very well, just like in adults. They can have similar side effects as adults, a sore arm where they got the injection. They could have some fever or aches or fatigue. Those are all possibilities. Emily is with DPH. So they can have those side effects. They bounce back quickly. They do very well. There's no significant issues or problems that they encounter. And in this study, all of the individuals who became infected were in the unvaccinated group, and none of the people in the vaccinated group developed infection during the trial period. And so the FDA felt that it was a very good study to show that it is safe and effective, as well as or better than in adults, but we'd say at least as well as in adults. The CDC has a committee, the Advisory Committee on Immunization Practices, that also offers its guidance on all vaccines, and they are going to meet tomorrow. And so my guidance has been to the state. I mean, people are welcome to use the vaccine effective immediately in 12, 13, 14, 15, because the FDA has approved the authorization of that. Most sites, if not all, will probably wait until Thursday, until ACIP offers its review of the data and its own independent assessment. My recommendation to sites has been just wait till Thursday. And then when both bodies have reviewed the data and made their public statements, assuming they are both aligned, which we all expect they will be, then people can move forward on Thursday. So here's where we need your help, and I look to you for your leadership in this. There are hundreds of thousands of students, between the ages of 12 and 18 who are in schools, and we need to get everybody vaccinated as much as possible, because kids and adolescents can get infected. They do get infected, and they can spread the infection. And overwhelmingly, they do very, very well with COVID infection. Obviously, other people don't do as well. And so we need to get everybody vaccinated. Is clearly the safest way to acquire immunity, not through the natural infection, but through the vaccination. We are hoping to make this as easy for you as possible. So first of all, I hope you all have a good relationship with your local health department. If your local health department has the vaccine, is willing to do it. Remember, Pfizer requires different storage conditions, so it still is a little bit trickier than the other ones. Please reach out to your local health department if you're willing to do that, and work with them to try to get your kids on the path to being vaccinated before they go home, and then they can come back for their second dose and be finished with this. Wild Health is the vendor that the state has contracted with. They've been traveling all over the state to vaccinate. They have played a large role at University of Kentucky's Kroger Field operation, and also helped us with our FEMA sites that we're doing in Laurel County and Henderson County. They've also gone out to colleges and universities and vaccinated students and staff at those institutions, and they've even gone to some high schools. So you can reach out to them as noted below. And Tony, I don't know, did you have the slide also that, and it may not be in this deck, that showed the, no, it's okay. So you can go back to that. They're also doing, if you reach out to that number, they're doing some Zoom sessions, I think tomorrow and maybe the next day. If you reach out to them, they'll do a Zoom session, answer your questions. They will do scheduling. They will come out to your school. They will do it during school hours. They will make this effortless. They'll work with you for the parental consent, and they will vaccinate anyone. They'll take care of any faculty that haven't yet been vaccinated, or staff or teachers, family members, anyone you'll allow to come where you set them up into that physical space to get vaccinated. They're happy to have come one, come all. It will be with Pfizer because that's obviously the vaccine that's approved for the younger ages. And they'll come back for the second dose and do the second dose at the same place they did the first dose. Now, let me put this in a different context. The CDC guidance says if you are vaccinated and exposed to an infected person with COVID, you do not have to quarantine. And I know there's more than one school who's had to quarantine, probably in this call, or a superintendent who's had schools who have had to quarantine because of exposure. So here's the thing, if all the kids get vaccinated and one of them still develops an infection, you don't have to quarantine the rest of the classroom. Anyone who's vaccinated in the classroom does not have to be quarantined. So let me broaden that further. Athletics. There's been some teams who have had their athletics interrupted by prolonged quarantines because infected kids exposed others. If all the teams are immunized, then they don't have to quarantine if they're under current CDC guidance, if the whole team is vaccinated and they were exposed to one person who had the infection. There's reasons for that. One is their likelihood of becoming infected is reduced by the vaccine. But two, even if they do get infected, the likelihood they have a high viral load is markedly reduced. And therefore, they're lower risk to everybody else and less likely to transmit it. And three, if you are vaccinated and exposed to someone, you're protected from the greatest harm. So for a lot of interwoven reasons, that's why the CDC is able to say, if you're all vaccinated, you don't have to quarantine. So I hope the superintendents will reach out as well to your coaches and encourage the coaches, because when we look to the fall sports seasons that will start, and when they start practicing, probably I think in mid-July or so, right, that if they go and get their first dose over the next 2 to 3 weeks, they can get their second dose in time so that they're all fully vaccinated and ready to go practice in the midsummer, and they won't have to quarantine if they're exposed to someone who is infected. So this is a really great opportunity to get school back as normal as possible. You can imagine in fully vaccinated classrooms, or if classrooms where nearly everyone is vaccinated, that the whole physical distancing paradigm doesn't have to apply. And now that's not all, the CDC hasn't put that in their new guidelines yet, but things will change between now and the fall. But the key to all of this is getting as many people vaccinated as possible in order for those other parameters to be further adjusted. Let me offer a few other things, and then we'll see if there's any questions or if Dr. White has any cleanup to do on any misstatements I may or may not have made. Because it applies to you in other areas, healthy at work, the governor announced yesterday that capacity restrictions will be raised further on May 28th. So that's the Friday before Memorial Day. So they'll go up to 75% of capacity for gatherings up to 1,000 people, and 60% of the venue's capacity for gatherings over 1,000 people. Additionally, we will clarify the healthy at work guidance so that the physical distancing part of it, the 6 feet, is made clear that it is a recommendation that You still maintain space between unrelated household units, but it won't be a rigid requirement, meaning that people will be able to be closer than they previously were, which is going to be obviously of great help for these venues under 1,000. And I believe he said that yesterday, but I know that if he didn't say it, I know that this is what we're planning to do. And then anticipate, because he has already said this at press conferences, that pretty much all these restrictions, or the vast majority of these restrictions, are likely to go away by early to midsummer. And so how that plays into healthy at schools is to be determined, though, still, because CDC has very specific guidance for schools, for K through 12 in particular. And so I think we would still encourage KDE to align with what CDC guidance is. And so I think you can anticipate the fall being much better this coming year by far and away than what we had last year in this entire academic year. But the specifics are still going to be in flux as we look to the CDC for its guidance. And so more to come on that. And then the final thing I would share is state of Kentucky received a $134 million grant to provide and make available COVID testing for schools, K through 12 specifically and only. And we have spoken with Commissioner Glass and the KDE leadership team, and we are going to at KDPH. We're working on a request for proposals to let out contracts for laboratory services providers, where we will pay for the costs and you will be able to pick, hopefully this is the concept, pick from approved vendors who will work with you to make testing available within your districts. We'd like to do it at the district level and have the superintendents play a role for their districts for how to make the testing available. It's available for private institutions as well. So, if you interact with your private colleagues, independent schools, religious schools, when this comes to pass, if you could help us with just making sure your communities, the educational institutions, are all aware. Again, this is the federal government making this money available for this very specific purpose. It is specifically and only for COVID testing to keep kids in school. It applies to to staff and teachers and students and the whole lot that have to do with keeping the school bus drivers, contracted service providers, people who are next year at the start of the school year. And we're pushing it to try to have information by midsummer. And then the final thing is we work on the vaccination. Anything you can do, please, to jump on that right away, to reach out to your health department, to Wild Health, or if you worked with Walmart, to vaccinate your teachers and you were very happy with their service, feel free to reach out to Walmart. I think they're willing to help with this activity too. Whoever you're comfortable with, if you could please jump on that quick so we get this done as fast as possible and everybody get back to their normal lives, that'd be great. That's all I have. And Connie, did you have anything to correct before Commissioner Glass takes it back over?
Well, I didn't have any corrections. You don't correct your supervisor. But I did want to add some things. You don't have to do the quarantine if you are asymptomatic. And I think everybody knows that. That's been guidance that Dr. Foster's team has put out. So if someone's vaccinated and they're asymptomatic, they don't have to quarantine. I did want to point out that 15.3% of our cases of COVID in Kentucky have been in the 0 to 19-year-old age group. Because I think some people think that it doesn't happen to young folks, but it does. And I wanted to point out that in the email that Tony sent out on Friday, it lists those 2 Zoom meetings that Dr. Stack was talking about. And I did have them in the box. I was going to read them to you. So go back and look at that email, but the Zoom meetings are tomorrow on the 12th at 10 o'clock and noon, and then Thursday on the 13th at 2 o'clock. And there is a question here, Dr. Stack, from one of the members, and I wanted to just read that to you and get your response. Does KDPH recommend or support no mask outside for elementary age children, such as recess? The governor's executive order 202-27B, that's 8, sorry, my eyes are old. 3C states, in outdoor spaces and venues with fewer than 1,000 people in attendance, wearing a face covering remains recommended for non-vaccinated individuals whenever they are within 6 feet of anyone outside their household. However, the Healthy at School document states masks are not required outside. We want to do what's best for our students and keep all safe, and have been following the recommendations to still mask if within 3 feet outside, but parents are reading the Healthy at School document that says differently. What is DPH's suggestion?
Yeah, for gatherings of 1,000 people or fewer outdoors, you're not required to wear a mask, period. We still recommend you keep space between unrelated household groups, but it is a recommendation, okay? It would be preferable, and if you're not vaccinated, and I get what you're saying here, it's because the kids are not vaccinated, we recommend if you're vulnerable, you wear a mask, okay? But in a group, the operative thing is for the requirement for gatherings of 1,000 or less that are outdoors, you are not required to wear a mask. The mask EO does not require it. Now, Healthy at Schools is the, KDE operationalizes the school guidance from CDC and then what the governor's executive orders are. And so if the KDE document says you don't have to have a mask, I'm okay with that because that's consistent with what with what the mask EO says currently.
Thank you.
Commissioner, I probably took more of your time than you anticipated, so I will stand down, and Dr. White has agreed to stay for the balance as usual, but I'll drop off.
Thanks, Dr. Stack, and thank you, Dr. White. Great information and exciting information about vaccinations and how those will be available and testing for schools. So we're grateful, as always, for your support. We'll shift gears now, and I know that there are lots of questions about the American Rescue Plan, ESSER funds, the third round of ESSER funds. It will be the largest infusion of federal dollars ever into public schools in the United States. So there's so much that we can do with this, but we know that there are questions, and there are some more earmarks and restrictions on these funds than on other funds. So we'll bring on Robin Cheney now and her staff to talk some more about this.
Thank you very much, Commissioner. It's a pleasure to be with you this afternoon. Our first slide really talks about the naming of this new round of funds. We talk about it as ESSER 3 sometimes, but we are trying to train ourselves and our staff to really reference it as ARP ESSER, the American Rescue Plan ESSER. So you'll see, if you see ARP ESSER or ESSER 3, those are kind of interchangeable, but for this presentation, we're going to call it ARP ESSER. As we start out, just wanted to remind you of a really good reference tool. It's in the first slide on the link, US Ed ESSER fact sheet. It does a great job of comparing the various fundings from the various rounds of ESSER and is sort of a quick reference sheet that you can use when you have questions about what applies to which round of funding. I also wanted to just take a minute and compliment the good work of our local school districts of where we are to date. So under ESSER 1, which is our CARES Act money that came, and you'll see the expenditure timeline that is still available on that, but 67% of the local district fund allocations have been reimbursed as of April 30th. So districts making very good progress and use of that first round of funding. As a reminder, for ESSER 2, which was under CRISA, that timeline for expenditures is through September 30th of 2023. And we are still receiving and expect to receive assurances and spending plans from our local districts through May 15th. So that's coming up quickly. With those assurances and spending plans, of course, districts have selected whether they would like to participate in that district opportunity out of the state set aside from ESSER 2. And we will be posting those dollar allocations following the expiration of the submission deadline on May 15th. So watch for that next week. And then finally, ARP ESSER, which is what we're going to spend most of our time talking about this afternoon, is through September 30th of 2024. And we are providing notice to you today that the assurances and spending plan for ARP ESSER will be July 31st. Those assurances and spending plans are not available yet, and we'll kind of explain a little bit about that as we go through our presentation today. Next slide, please. The ARP ESSER is a little bit different. So just as a quick reminder, Kentucky received over $2 billion from ARP ESSER, with 90% of that amount going to local school districts in your allocations. Those allocations are posted on our federal grants page, so you can go there and see exactly how much your district has been allocated. The full allocation for your district is posted. However, KDE has only received 2/3 of the overall award for Kentucky. The remaining 1/3 has not been dispersed as available to us yet, and it will be released upon approval of a KDE application and plan from the state. And we are currently in process of completing that plan for submission on behalf of Kentucky. Again, the ARP ESSER funds are available through September of 2024. Next slide, please. So I'd like to spend a few minutes kind of talking about the ARP ESSER funds in the two buckets that we're familiar with from prior conversations about ESSER money. But first, let's focus on the state set-aside portion, and I'll share with you some things that are going on with the state set-aside portion. Kentucky, from the state perspective, is required to submit a plan by June 7th. So we are currently working on that. I will share with you that this plan and application looks very different from the prior ESSER plan submissions that we've done from the state level. We can tell with the change in a new administration, this one is a lot longer. It is an 18-page application with lots of questions, not only about what the future intended uses of this pot of money, but it's really asking for a lot of information on prior uses of the other rounds that we have already received. So it's taking some time to put all that information together with our cross-agency team. It's also asking for a lot of data to be provided. So it is taking a little bit more time, but we will have that completed and submitted by June 7th. We also see for the first time in the ESSER round of funding a concept of meaningful consultation. It's an important term that you'll see both in the state plan requirement and also in the local district requirement, but meaningful consultation with stakeholders. And you'll see on the slide here, we've put sort of the guidance that we've received from the US Ed on what meaningful consultation looks like. Last week, KDE actually posted a survey instrument to allow for input by stakeholders on the state set-aside dollars. So you'll see that there is this desire, and you'll be, as you prepare your local district plans, a desire to make sure that meaningful consultation is happening in your local communities. Next slide, please. The other concept that you'll see in both the state and local distributions is you see this concept of an SEA and a local district reservation. So sort of a carve out of your funds that are being allocated. At the state level, we have a 5%, 1%, and 1% reservation requirements. The local district reservations will look a little different. The 5% of the total state allocation is for implementation of evidence-based intervention, specifically aimed at addressing learning loss, and then it gives some examples of what that might be used for.
And Paul, before you go away,
we also see a 1% of the total allocation has to be used for evidence-based summer enrichment programs, and another 1% for evidence-based comprehensive after-school programs. So here's a term that we haven't seen in the other ESSER allocations. It is this concept of tying it to evidence-based programs or interventions. Programs or interventions. So in evidence-based intervention, we actually have a link to a web page on the KDE website that can help you as you're looking at what evidence-based practices you need. For Kelly Foster's office, in the Office of Continuous Improvement and Support, we'll be providing additional information in upcoming webinars to assist on determinations about evidence-based. Next slide, please. We also see unique and different for this round of funding, this requirement of posting things on the website. So there's requirements about public posting of certain information. So we see this at the state level. The state must post on our website the number of schools in the state providing each mode of instruction, and we must publicly make available student enrollment data and to disaggregate that by certain student groups. Our data must be posted online by June 21st, 2021 and regularly updated. And I provide this information to you to make you aware that we're currently going through data that exists and is readily available here at the department, but we may be reaching out to districts for further assistance to meet some of this reporting requirements. Next slide, please. So let's now turn to the local district requirements. I had referenced earlier that the spending plan and assurances will be due by July 31st. Not yet available because we are working through some things that will need to be added to ESSER assurances for this round that you didn't see in prior rounds. Local districts are required to reserve at least 20% of your funds to measure and address the academic impact of lost instruction time on students. And then we see that language again through the implementation of evidence-based interventions. And then the interventions must respond to the student's academic, social, emotional, and mental health needs. So your requirements and the set-aside are a little different than the state set-aside. In addition, after that 20% set-aside, the remaining 80% set-aside can be used for other permissible and eligible expenditures that you've seen consistent with ESSER 1 and ESSER 2. So that reservation of 20%, you make sure you meet that, and then the rest of it is very consistent with eligible expenditures from the prior two rounds. Next slide, please. So local school districts will need to come up with 2 plans for access to the ARP ESSER funds. Your first plan, and they are both required to be posted on your website and made available in an accessible format. Your first plan is going to really address how you're using your funds, how you contemplate that you will use the funds that have been allocated to you. That's both the 20% and the remaining 80%. And then also focusing on how you're going to ensure that those interventions address that academic impact of lost instruction time. Next slide, please. Oh, and I'm sorry, on the last slide, I failed to mention, but it also talks about that meaningful consultation with your stakeholders. The same requirement, thank you very much for going back, that meaningful consultation with stakeholders that we saw in the state requirement also appears in the local district plan. So you'll need to make sure that you're making those efforts to consult with your stakeholders. Thank you for going back. Let's move on to the next slide. There's also a plan required from our local school districts that receive ARP ESSER funds, your plan for safe return to in-person instruction and continuity of services. As I frequently remind myself, this is requirements for all the states in the United States. And so many states have not yet returned to safe in-person instruction. And so Kentucky is a little ahead of the game there. But what they are asking for is that plan of how you will maintain the health and safety of your students, educators, and other staff. And then Dr. Stack had mentioned earlier in his presentation about alignment to the CDC safety recommendations. And so your safe return to in-person instruction and your continuity of services plan will need to address how you're doing that. And there's some bullets on there that talk about the things that you need to address moving forward. Many of our school districts, of course, are already in person in a hybrid mode and have really worked through their plans and policies aligned to these CDC safety recommendations. So this plan will be one that you already have a really good head start on. Next slide, please. Your plan also has to include a process for the regular review and adjustment of your plan at a minimum of every 6 months. Again, you see that meaningful consultation with stakeholder groups and opportunity for public comment. You also have to post that on your district website and make it available in accessible form. I know some districts have already inquired because, again, I think Kentucky is a little ahead of the game in this regard. So there was a reference in our earlier webcast that talked about if you had a plan in place before March 11, 2021, could you simply use that plan and post it? As we have received additional guidance from US Ed, it is important that if you're going to use a prior plan, that you have fulfilled the requirements of meaningful consultation with your stakeholder groups and you have provided opportunities for public comment. If you have not done that, then you will need to go through those steps of the process. Next slide, please. Finally, I want to keep on our radar in that first slide at the beginning of the presentation, we talked about that very quick sort of fact sheet. That was a quick help to local school districts on the comparison of the different fund sources. And I want to remind us, in addition to maintenance of effort requirements, ESSER, ARP ESSER has an LEA maintenance of equity requirements for high poverty schools. I have included this slide. Again, we still don't have a lot of guidance from US Ed, so I want us to keep this on our radar together as we continue to learn more. We participate in weekly webcasts from US Ed and CCSSO. There are lots of organizations trying to help us work through some of these issues. And as we receive more information on this, we will certainly make you aware of it, but just including this in the packet so that we keep this in front of us. Next slide, please. As part of that maintenance of equity, there are some determinations that need to be made by the state first. And so as we learn more and we receive that additional guidance from US Department of Ed, of course, we will make that available to you. That concludes sort of my remarks today on ARP ESSER, but we have several more updates we'd like to share with you from the School and Community Nutrition Division. So I'm going to turn it over to Lauren Moore now to talk about waivers and things that we're learning from the food service front. Lauren, I'll turn it over to you.
Thank you, Robin, and good afternoon, everyone. In February, the USDA released information about funding available to eligible program operators called the Emergency Operational Costs Reimbursement Programs. There are two separate programs, one that is available to program operators who typically administer the National School Lunch and School Breakfast Program, and one that is available to program operators who run this Child and Adult Care Food Program. The CACFP reimbursement program includes school districts who participate in the at-risk after-school care program as well, which many of our school districts do participate in that program. These programs are meant to provide additional funding to local child nutrition program operators whose revenues decreased or were interrupted during the early days of the pandemic. And that time period is for March 2020 through June 2020. Kentucky's initial application, all initial applications for the nation were due in February, and our application was approved. And then this past, just yesterday actually, Monday, May 10th, the implementation plan was due, and that plan has also been submitted. Once the implementation plan is approved and we have finalized who is eligible for payments, the Division of School and Community Nutrition will send information to applicable food service directors about the timeline for payment disbursement, allowable use of funds, and reporting on the use of funds. Next slide, please. A little more detail about these funds. Eligibility for each of these programs is limited to program operators who have maintained their participation in each of these respective programs. Maintaining participation is defined as either filing valid meal claims in a month or months between September 2020 and December 2020, or by signing an assurance document that certifies that you will resume program operations at the conclusion of the public health emergency. The majority of our Kentucky school districts have been operating the summer food service program, and if your district typically operates the National School Lunch and or school breakfast programs, but has been operating the summer food service program for this past school year, no assurance statement is required for those school districts. As I mentioned on the prior slide, calculations for these payments compares federal claims reimbursements in March, April, May, and June of 2020 to federal claims reimbursements in those same months in 2019. So, for example, the calculation takes the amount of the claim from April 2019 and subtracts the amount of the claim in April of 2020. And if that amount is a positive number, meaning the April 2020 claim declined from the comparison to the April 19 claim, that amount is multiplied by 55%, and that becomes the payment amount to the district for that month. And each month is calculated separately. So it will not each March, April, May, and June, all separate months. There are some other considerations in the payment calculations, and a couple are listed here at the bottom of the slide. One that is not listed here that may be relevant to your school district is that if you operate both the school meal programs and also the child and adult care at-risk after-school care program, your district may be eligible for a payment from both of those reimbursement programs. Next slide, please. The last information I want to provide is related to USDA waivers for next school year. The main changes for next school year are the programs that may be operated in your school districts. As I mentioned before, in the current school year, most of our districts are operating the summer food service program. For the upcoming 21-22 school year, the USDA has not extended waivers to allow the operation of the summer food service program, but rather has offered waivers through what is called the Seamless Summer option. And the Seamless Summer option is an option under the National School Lunch Program. If districts elect to use the Seamless Summer option waiver, they may still provide meals at no cost to students, regardless of the student's eligibility. And districts may also choose to feed other children in their community, as has been done with the Summer Food Service Program. The USDA is also allowing operators that elect the Seamless Summer option to claim meals at a higher rate. The Summer Food Service Program rate is higher than the Seamless Summer option, but one of the waivers offered by the USDA is allowing the Seamless Summer option meals to be claimed at the higher SFSP rates. Your school district may also choose to operate the typical school meal programs, the National School Lunch and School Breakfast Program. However, if your school district elects to do this typical school meal programs, the regular rates would apply. Other waiver flexibilities are listed here and are similar to flexibilities offered during the current school year. The non-congregate waiver, which allows students learning remotely to receive meals, the waiver of mealtime restrictions, parent-guardian pickup, and then meal pattern flexibilities. And finally, SCN has already sent information to your food service directors about an information session taking place on May 18th to provide more information about the Seamless Summer option. And there will also be information distributed to your food service directors regarding how to opt in or to elect to participate in the waivers and how to apply for some of the waivers. Thank you, and I will be here during the question and answer session. And back to Robin. Nope, sorry, maybe back to Tony.
Back to Tony.
And I will introduce our next guest, which is Christina. Christina is going to be talking about trauma-informed plans and the School Safety and Resiliency Act. Christina.
Thank you, Tony. Next slide, please. So as a reminder to everyone, the School Safety and Resiliency Act modified a lot of different aspects of our school safety legislation, and the statute that you see here is a summary of the different elements that are required for the trauma-informed plan that is due July 1st of this year. There's a requirement that each local Board of Education develop the plan for implementing a trauma-informed approach in its schools. And you can see the 5 components there that are required to be a part of the plan. Just note that this plan does not need to be sent to KDE, but it does need to be approved by the local school board. And as with any plan, it should be reviewed regularly for continuous improvement. Next slide, please. So this statute includes more information about the trauma-informed team. So it's the school counselor or the school-based mental health services provider at each school that shall facilitate the creation of a trauma-informed team to identify and assist students who've been impacted by trauma. The team can consist of the different roles that are listed there. And so what's key to remember here is that it's the district plan that is required to be approved by the local board, but the law also requires the creation of school-based trauma-informed teams, which we'll talk about next. And just bearing this in mind, we want to encourage folks to think about leveraging existing cross-disciplinary teams that you already have in your districts, such as the ARC or the school safety and threat assessment teams that were also required by the School Safety and Resiliency Act. And so I'll talk about that later. Keep in mind also that previously districts received funding for the school-based mental health professionals. And although I don't think that money has come down to the districts yet for through the current budget, that was reallocated this year to maintain support for these roles. Next slide, please. So this is the portion of the statute which describes the trauma-informed team. And again, it's the counselor or the school-based mental health services provider that is leading the team in the creation of this work to provide training, guidance, and assistance to the other administrators, teachers, and staff on recognizing the symptoms of trauma in students, utilizing the interventions and strategies to support those needs, and then implementing a plan for the trauma-informed approach as described in subsection 5. Next slide, please. So one of the additional requirements of the law was for KDE to create a trauma-informed toolkit. So this slide obviously describes that. We do have the toolkit posted to our website, and we continue to add tools as they are developed. We really think of this like a toolbox, and there are different tools that you'll need for different situations, and we're continuing to add tools to that. We also partner with the UK Center on Trauma in Children, or CTAC, to provide free training on trauma-informed practices for educators, schools, and districts across the state. So many districts have already participated in that training and will give you a good basis for developing your trauma-informed plan. But there are additional training opportunities available, again, at no cost. So you can reach out to us if you're interested in getting more information on upcoming training opportunities through CTAC. And again, those trauma-informed tools are linked on our website on the School Safety and Resiliency Act webpage. We expect that there may be a need to supplement existing resources within the specific guidance information that Kentucky's educators have on what to do when they receive a notice that a student has been trauma-informed, as well as the integration of a threat assessment team into the trauma-informed approach. So we will be working on providing some additional resources around those aspects of the requirement there. Next slide, please. So here are some training opportunities that are being made available by 2 groups that you may have heard of. The Bounce Coalition is a group out of Louisville working with a co-op to provide some training on May 25th. And you can contact Carly Mosby about getting more information on that training. I believe that one does have a small fee for the team that participates in that training. But it's really going to be kind of a workshop where you develop the plan during that time. And then the Kentucky Council for Children with Behavior Disorders, that group you may have heard of because they're the primary sponsors for the Behavior Institute annually. And they will be providing some different training opportunities that are in a more intensive series of opportunities on the dates that are provided there. So you can reach out to kyccbd.org for information and registration. And what I have been told from these two groups who have also collaborated with one another to make sure that their support that they are providing is aligned so that they're having kind of a common message and you're not going to get necessarily a different message from one group versus another about how to approach this. So they've been in touch with one another. And so if you participate in the bounce training, you know, it may not necessarily benefit you to participate in the KCCBD training. But again, there are options that are available to you. And, you know, the reason we mention this to you is so that you can have your trauma-informed team members plan to participate in these opportunities. And from what I understand, there will be no cost for the KCCBD training. But again, reach out to each of those groups about the details of that since they are not KDE sponsored events. That's all. Thank you.
I think we have Meredith on to talk about the supplemental school year program and the GMAP system.
Good afternoon. I have just a quick update about the process for schools, school districts to submit their participation status. So all districts are required to submit their status by June 16th. And the way we'll collect this is through GMAP. The form that I'm going to share will be available after May 17th. And to access it in GMAP, you'll go to search, which is on the left-hand side of the GMAP platform, toggle to application supplements, select the 2022 fiscal year, and then make sure that Senate Bill 128 assurances is highlighted. So next slide will show what that will look like once you follow those steps. There is a box at the top of the page that says my district is not participating in the supplemental school year program. So if your local school board has decided to not participate, then you will just check that box, save the form, and then your submission will be complete. However, if your district has decided to participate, then you will go through the assurances and you'll select yes or no for each of the assurance statements that is listed on the page. And then you'll save and exit out, and that is how you will let us know your status. We shared on a prior webcast, we are not collecting the implementation plans for each district. However, those should have been shared with your local school board when they were deciding whether or not to participate. And that is all that I have.
Great, thanks Meredith. And Tony, let's bring up some questions and see if we have any questions from our viewers.
Okay, all right. I think there's a couple in here. So I'm going to start with, I guess we'll just start right at the top. There is some confusion about how ESSER funds can be used for renovations and construction. So can we get some clarification on that? Robin, can you help us with that?
Robin's had to step off for family medical concern, so we may have to circle back. Looks like Kelly's popped on. She may have some clarity on that.
Perfect.
Well, in reality, no, I don't, but she just asked me to cover her question. So I am not facilities person, but we will follow back up if I believe it says in the list, Tony, who submitted that. Is that correct?
It does, yes.
Okay, so I will make sure Robin gets that question and get something back to the submitter.
Perfect, thank you.
And it's going to matter some which pot of funds we're talking about, because there are different restrictions in each group, from ESSER 1 to ESSER 2 to now this ESSER 3 that Robin is trying to disabuse us from using that term, the ARP ESSER fund. So the last group, which is the largest one, does have also the most restrictions that are around it. So you can look at the slides that Robin sent out, or that Tony sent out, that relate to the ARP ESSER plans, the sections in that relate to the LEA, the local educational agency. Those are the restrictions that we know about so far. But really anything that's allowable, you can spend it on anything that's allowable under that whole act, with the exception of those carve-outs. For example, 20% we know has to be used for mitigating academic lost instructional time using those evidence-based practices. But other than that, it's pretty open.
Okay. I think our next question is on the supplemental school year. And I'm just, again, this is going to be the weeds for me, so I'm just going to go ahead and state it from the Google form. We know that Infinite Campus provides a way to easily identify individual students within IC. Will KDE consider allowing districts to identify schools who choose the supplemental school year, if given board approval, and exclude them from 4- and 5-year cohort graduation rate calculation? If not, how do we plan to fully implement the ramifications of schools who fall into CSI if the only reason they are in that category is, and it's a longer question, but if Rhonda is on, I'm wondering, because it looks like this has to do with accountability and assessments.
Yes, Tony, I am on.
Thank you, ma'am.
Yes, I have a odd camera angle here, but actually we legally cannot exclude them from the cohort. Those rules are federally based, and it is a well-defined in federal law. So while we can look at some other ways that might play out in the accountability formula for the state, we cannot make the change on the cohort.
So what things we can do, and we are looking at every option possible to consider how we handle the impact. One of those that we've talked about is if we are in the case where a district really is pitched into a lower performance category or into one of the lower accountability categories because of that issue, we could use an appeal process to evaluate, did that indicator, was that the element that shifted negatively that caused it? So that would narrow it down to really a small number of districts or schools potentially that this would impact. So that's one of the avenues that we're looking at, but we'll evaluate all of the possible ways that we could accommodate the changes that are necessary because of this shift in state law that isn't aligned with federal law. And we're still looking at that and thinking about what could we do, but we're going to be bound by federal law, federal regulations about how we have to count these students. And honestly, it's one of the elements that we signaled or let the legislature know there will be unintended consequences with this, because even though we can change state law, we can't necessarily change federal. That doesn't change federal law, doesn't change federal regulations, and we're also seeing the impacts on NCAA eligibility and athletics. So it's got these far-reaching implications for some students. But what we can assure you is that we'll look at all of the possible avenues to address what may be a change in the graduation rates and how we might accommodate that.
Muted myself, I apologize. So the question, there was just a question in the forum on, will we get a format for the Senate Bill 128 plan to submit? And I think that might have been before we got to that point in the PowerPoint. And so the GMAP form is it. And we just provided that information in the webcast, and it's also in your PowerPoint. So I will go to the next question. There was a question about a Wild Health. Let's see, we are scheduled to have a Wild Health CV-19 clinic this Thursday, and they wanted clarification. I believe Dr. Stack just said to wait until more information comes out from Pfizer on Thursday. Should we reschedule for another date? Dr. White?
No, what he meant, what he was saying is that the FDA has now approved it. It has not gone through the CDC, the ACIP committee, but legally you can use that that vaccine at this point in time. By Thursday, we are anticipating ACIP will have approved that, and so Thursday would be an appropriate time for you to do that vaccination of that age group.
Okay.
I was just on a call with him before this call when he was meeting with health department directors, and that was what he told them. He said that by Thursday, once ACIP approves this, that he was giving them the go ahead as health department directors to go ahead and start vaccinating. So I would say the same for your team.
Okay. All right. I'm going to look back over here, make sure I haven't missed anything. Oh, it looks like there's another ESSER one. Let me see if I don't know with, Robin, we may have to get back on this one. Let me just see if this is something general that the commissioner can answer. Yeah, it just says they would like an update about using ESSER funds for facility upgrades as well. So we will get back with you on that as well. Perhaps we can draft an email. I'll get with Robin and we'll see if we can get something together for superintendents. This seems to be a theme. So, and then Dr. Glass, I think that, I mean, I know it's early, but I don't see any more questions in the Google form. Sometimes they sneak up in my emails. Let me go over there and check.
Tony, I'd like to share a couple dates before we go, if that's
Perfect.
okay.
Perfect.
As Robin mentioned earlier, when we're thinking about the ARP ESSER plan, during the June webcast, we'll be giving additional information around those requirements that she shared with you today for the LEA plan. And hopefully we'll have more guidance by then from Ed and CCSSO that we'll be able to share with you. But the following week, we will be hosting 2 webcasts that will help you with the evidence-based requirements. And so I wanted to go ahead and share those dates and times with you so you could put those on your calendar. We'll be doing one on June the 14th from 2 to 3 p.m. and June the 16th from 9 to 10 a.m. And we will record those, but June the 14th from 2 to 3 and June 16th from 9 to 10. So if you want to put those on your calendar and share those with the folks in your district that will actually be helping you with the ARP ESSER LEA plan, that webcast will be very beneficial to you in your work around the evidence-based practices piece.
All right. Thank you, Dr.
Tony, I do just want to clarify because I just received an email. So that form in GMAP will be available May 17th, but districts obviously do not need to make a decision until June 1st. That's when local school boards need to decide on their participation. And then that form does need to be completed by June 16th. So, and that is the only documentation that we will be collecting as far as the implementation status of the districts, and then there'll be additional information about Infinite Campus and how students will be recorded as they're participating in the program.
Okay. Great. So unless there are more questions, let me go back. Just a reminder that our next Superintendents Webcast is Tuesday, June 8th. Let me make sure. Okay, looks like there is a question about trauma-informed care. Hold on one second. Let me read this one. Let's see here. Did I hear correctly that the trauma-informed care plan only has to be submitted to our board, not KDE?
That is correct. It needs to be approved by the local board. It does not need to be submitted to KDE.
Okay. All right, Commissioner, I think that is it. We may get out of here in under an hour with a very packed agenda. So.
Okay, great. Well, thanks KDE staff for all your preparation. Thank you, Dr. White, and please extend our regards to Dr. Stack for being on with us as well. Connie, the only thing that I would correct you on is that you said that you don't ever correct your boss. The staff at KDE correct me constantly, and I welcome it. So it does happen, and it's welcomed at least in our shop. So
I do it very subtly.
Subtly, right. All right. Thanks, everybody. Have a great afternoon.
Thank you.
Thank you.
Bye-bye.